practice of neurosurgery, to me, is one of the most fascinating areas of medicine. We are faced, as neurosurgeons, we are faced with insurmountable challenges to combat diseases that rob individuals of their identity and prevent them from interacting with society in a normal way. This, to me, represents an enormous challenge and responsibility, and studying clinical neurosurgery at the University of Toronto is really exciting for me, an exciting challenge for me. I think the University of Toronto is a very unique place. The people here are unparalleled in their clinical and research efforts, and you can literally knock on anyone's door and ask for help with a given project or a given idea, and they'll welcome you with open arms. It's a place of productivity, and it's a place of shared enthusiasm for clinical medicine and for research. I was first exposed to global health issues while traveling around Central America in between summers during medical school. And to me, this was the first time where I was made aware of such disparities in available health care around the world. And ever since then, I've had a passion to try to understand this problem a little bit more and contribute to its solution, even if it's only a small bit. In medical school, I engaged in many different electives to try to further that exposure in international health. And during residency, I enrolled in the Global Health Education Initiative course here at the University of Toronto. I followed that up by surrounding myself and immersing myself with mentors who shared this same passion, including Dr. Mark Bernstein, Dr. Moji Hodai, Dr. Claire Payne, and Andrew Howard, all leaders in their respective fields, and all show a passion to try to mitigate some of the disparities in global health around the world. I continue to work with these individuals and continue to work with the Ethiopians in Addis Ababa to develop a neurosurgery residency training program. These are only some of the initiatives and some of the ways that I've been involved in global health over the last few years. I think the Global Health Education Initiative course here at the University of Toronto offers residents the opportunity to become familiar with a knowledge base that allows for the application of their interests in global health. At least for me, I was exposed to the legal aspects of international health, some of the research aspects, and many diverse areas that different physicians are currently engaged in here at the University of Toronto. I think it provides a foundation of knowledge that can be applied in many different ways to achieve different goals of an individual who is trying to understand and promote equity in global health. One of the big projects that I'm involved in right now is in building a neurosurgery residency training program in Addis Ababa, Ethiopia. And a lot of the skills that I acquired in the Global Health Education Initiative have helped me along that path in numerous ways, from understanding how health is delivered in resource-poor settings, the nomenclature associated with writing and reading about global health issues, and also providing me with a strong literature base for which to use as a platform for my own writings in this respect. It's great to meet so many people that are engaged in a common theme. It's nice to interact and to meet people with common interests at the University of Toronto.